Hey y'all, I recorded a big long update about a week ago, and then it needed actual editing, which I haven't done yet, and I've been sick and I haven't been able to get the editing done. So I'm just gonna scrap that one and do a quick little update, especially since there's been more going on. I'm moving some stuff around. I'm waiting for my son. He's got a short day. He at his homeschool program today. He just got back to school. They had like 6 weeks off, and it was ridiculous. So let's see. I just got out of my regular doctor. It was actually a nurse practitioner. It was a scheduled appointment just as a follow-up, so he could keep tabs on what's all going on, refill prescriptions, and touch base. So unfortunately, I've been sick with a cough for about 3 weeks. That might be going away. And then yesterday I got some sort of GI bug, I assume, where I was nauseated and threw up and all that fun stuff. No fever. Don't know what's going on. But I feel terrible. I have body aches. Would rather just be sleeping right now, but I have to parent my child. So, we had a preview yesterday and what it's going to be like post-surgery, where he wants me to do things and he wants me to play with him, and I physically can't do it. I was able to feel a little bit better and get him to do some schoolwork, and we watched a movie, and I did some puzzles with him while sitting in a chair and trying to like relax and then lean forward and do a couple pieces with him. And then anyways, it's going to be hard. So I had a second opinion with Dr. S. And he's not the doctor that I wanted to see for a second opinion. I wanted to see Dr. M. These are the neurosurgeons, because I know somebody who had surgery with Dr. M, who had a Chiari malformation decompression with Dr. M. But he was going to be out of the office the week of my appointment, and they called and said, hey, will you see this other guy? So I went. The nurse assistant was amazing. Hilarious woman, and we bonded over French, because she's from a French-speaking African country, and I could tell right off. And so she even said my last name properly, which she was furious that people say it some mangled American way. It was so funny. And then So then I had a nurse intake, and that was really, really thorough. I even forgot a couple symptoms, and I still feel like it was really, really thorough. But then this was like a week or two ago, so it's a little blurry. And then the doctor came in, the neurosurgeon, and I guess he talked with the nurse, and they, shared some stuff, and he looked at my MRI, and he said, no, you don't have Chiari, and no, you shouldn't have surgery. It's not going to help your symptoms. And I said, well, what about instability in my neck? Could that be what's causing my symptoms? Because there's a big overlap in symptoms between Chiari malformation, or a herniation of the cerebellum, and things like basilar invagination, cranial-cervical instability, atlantoaxial instability. I have a little background in, my brain's going. I have a little background in medical terminology and anatomy, so at least I feel like I generally don't completely mangle these things. So he said, no chance of instability. So I was like, okay. So I wrote down everything he said, and then I felt frustrated for a little while, and then I realized, this is just confirming that the doctor that I have, Dr. G, knows what she's talking about for the most part and is good. I had a teacher pull in next to me, and I didn't want to catch them on film. So I felt more comfortable with Dr. G and knowing that her plan is solid. I did try to get approval for a... is she still getting in and out of her car? I tried to get approval for a upright MRI, and I would have had to go to Indiana for it because there are none in Michigan. I could not get approval for an upright MRI, despite the fact that it would have flexion and extension, because I just had an MRI of my neck done in December. And so insurance was like, nope, you've already had one like this, even though it's a completely different procedure. So I figured I wouldn't be able to fight that. I did also contact one of the world-renowned specialists who deal with craniocervical instability and Chiari. I wrote an email, surprisingly got an email back from the doctor. Also surprisingly, he said, well, we don't take Medicaid, so I can't help you. What I wanted from him was a $300 consult. It's a virtual consult for him to look at my MRI. So first he would look over them, and if he felt like we needed to have a consult, then he would set one up. So it wouldn't be like just $300 for him to look at it. He would look at them and say, yes, I need to see her and I need to tell her what's going on. I realized too when I left the second opinion appointment that what I really wanted was confirmation. I wanted him to say, this is what you have. Yes, you should go through with the surgery. I didn't get that. But I was able to identify that he was talking out of his butt the whole time and he didn't know what he was talking about. I have probably read more studies on Chiari than he has. You know what I mean? Like that was hard. But that seems to be really common with Chiari and hypermobility and things that other chronic invisible illnesses, the doctors don't know. And you really have to do your research and find the doctor who is going to know. And that isn't picking and choosing and trying to find somebody who's going to diagnose you and do surgery. Dr. G does not do surgery if she doesn't think that you need to have surgery. She doesn't recommend it if she doesn't think you need it. Since seeing her November 21st and getting my diagnosis, I have developed more symptoms. I have issues walking. It'll come on after exercise, but also just randomly. My left leg is weak. Sometimes I walk like I'm drunk or like I had a stroke, and then I have to compensate with the rest of my body, and then because those muscles aren't responding properly, then my hip joint starts to hurt, which I have hypermobility in my hips that they used to subluxate regularly, and I was on crutches for most of my senior year of high school. So that was a while ago, and they generally are okay, but every once in a while they'll subluxate. I could do it on purpose, which would be painful, but it was a fun party trick. Anyways, so surgery is scheduled for February 17th. I have a friend who's going to be coming with me, taking me there, hopefully staying there the entire time while I'm in surgery and being there when I wake up. And then she'll have to go home to her family, and I won't have somebody there with me, which is pretty scary. I would really wish I had somebody who could be there with me the entire time, be there my entire hospital stay, but that's pretty unreasonable. All of my friends are moms, so it's a bit hard to say, hey, you should ditch your whole life for 3 days and come hang out with me at the hospital. My dad is going to take a week off of work, and stay at my apartment with my son so that he will be as consistent as possible with his normal life. I'm going to write out all kinds of details because my dad's not been very involved with us in the last few years, so he doesn't know like what our schedules are like and what our daily life is like. So I'm going to do my best to over-prepare, but not because he's incompetent, but just so that if there's an issue, they can refer to it and they can look at my lists or my schedules and they can figure it out. And if they do completely off-the-wall things and don't do anything like we normally do, that's okay too, because I know he'll be okay and my son will be fine with Grandpa. I was a daddy's girl. Wallace is a grandpa's kid. They love each other, and it's great. Let's see. I made a medical binder. So I have, it's here because I went to my doctor's appointment. So I have a medical binder that's got everything that I need inside of it. It's got a notebook. It's got papers from doctors. Each thing has there's sleeves. So I've got the sleeves of stuff with each things from different appointments, different stuff like that. And then I've got a case with all my CDs for surgery, and like my MRIs and x-rays and things are all in there. So that's pretty intense. I've had that sitting there going, I need to do this. I need to set up a page that's just got all my doctor's stuff, medical diagnoses and things, so it's like right up there so a doctor can see it and say, okay, I know what this person has going on. And I need to I want to do a video where I just talk about the different symptoms, so I need to basically print out sheets of the different conditions and different symptoms and what I have. So those are kind of the things I've got going on. I've got a fundraiser going. It's on a site called Free Funder. If you are able to contribute and you would like to, that would be amazing. Every little bit helps. It's been heart-wrenching watching the little money come in, $5, $10, $20, $100 at a time. It's been really amazing. And I was thinking of doing an Amazon wish list of things that my kid and I could use for post-surgery, things that would be helpful to me to have that way, because some people would prefer to do like tangible gifts. So like, hey, I'm almost out of vitamin C and I'm really going to need that during recovery. Things, I need a neck pillow, things like that. So I need to make up a wish list and get that on there. I feel like I'm constantly going. I'm constantly thinking of a million things. I've got lists with what I need to do, lists with questions to ask. I've got a list going for what I should pack for my hospital bag. Maybe that will be a video I can make happen. So I'm trying to keep this one a little shorter because I noticed my videos were getting like Harry Potter novels, where each one was a percentage larger than the one before. And what I recorded about a week ago was going to end up 30 minutes long if I edited it. Even with editing, it was probably going to be 20 to 30 minutes long. So that's crazy, and I needed to just start again and make a new video. Trying to think what else there is. I've started with a counselor, so that's good. I was supposed to have a second appointment with her last week, and then she had to cancel on me because she was sick. And then I was supposed to rescheduled was for yesterday, and then I woke up and threw up, so that wasn't going to happen. But interesting with that. Just thinking about a million things all the time. My brain is constantly going. Everything I've got to think of and prepare for. And I'm trying to realize that I can't do it all. Some things are going to have to get cut from what is on my lists. I'm not going to be able to get everything done. Like, I need to get my taxes done. Okay. We'll see. I hope I can get them done before surgery. I missed some things that I needed to do that had deadlines for printing out different paperwork, so I'm hoping I can figure out how to get that retroactively as best that I can. I don't know. I'm constantly thinking about everything. If you've gone through a big surgery and you have pointers, suggestions on what, doesn't have to be a Chiari decompression or a brain surgery, just if you've had surgery and you have suggestions on what to prepare for and what to expect and what to deal with, then that would be amazing. Any little tips and tricks. Did you bring a pillow to the hospital? I don't know if I should bring my pillow to the hospital. And move in for a week. I have severe postoperative nausea and vomiting, PONV, when I had 2 surgeries in the past on my wrist. And those were outpatient procedures, which should not have been quite so outpatient because of my throwing up. I should have been admitted, but I wasn't. So I'm pretty nervous about that. Throwing up with having brain surgery, not cool. And I've been growing out my hair, so it's crazy long. This is crazy for me. It's super thick and super stiff and wiry. Woo, crazy hair. But I've got some flat hat going on with wearing my winter hat, so at least it keeps it contained. I will get my hair cut at a barber shop about a week before surgery. I was told that a week is good because if I do get a nick, which I never had happen at this barber shop. Well, I think I got one once over my ear because my ears are pretty big and I got really stretchy skin up here. But I had they don't understand that, like, I've been shaving my head for 20 years, but I figured it'd be better to deal with the growing out phase now than after surgery. So I'll get it styled and cut. It'll be trimmed up the back, get off my ears. I can't stand it in front of my ears. And then I will be just dealing with the big scar on the back of my head. And then we'll see how I feel about my hair after that. If I decide I want to grow it out longer, which has never happened in 20 years, or if I want to make it, like, if I'm okay with the scar showing and things. So, all right, that is it. I'm going to hopefully get good results from my blood tests, but the fact that I'm double whammy sick means my white blood cell count might be off, and if they have to, or I could have a UTI because I get silent UTIs. So I could end up having to postpone surgery, which I really don't want to do. I'm preparing and planning everything I can get done, including things like my son's birthday is a few weeks after surgery, so I'm birthday present shopping. I've got cake mix in the cupboard and thinking about the things that I need to do. So even if he can't have a party, I'm going to do something. So I've got something for him. We can make a special day, and we can do a party when I'm better. All right, that's it. I'm going to close my eyes and rest for a little bit, work on my protein shake that I got to try to get some calories in me, and wait for my kiddo to get out of school. Bye. Subscribe and like. It helps us little people, not just because I'm short, to get seen by more people. So if you like it, the video and subscribe to me, it'll help get more people to see it, and then maybe I'll have more connection with other Chiari patients, things like that. Bye.